outcome to be measured. So we have defined terms. That's an easy one to measure. You can make sure that the student either has a textbook knowledge or a working knowledge of terms, and I always specify to them which I'm expecting.
And Nikki, on that one, I had a question on perception. Do you mean like perception of pain?
Mm-hmm.
Okay, because I think you should clarify that, because perception can be very broad.
Could you say pain perception?
How is it used? However, it's
in
used.
the book, it's only defined as perception.
Mm-hmm.
Is that when they ask you, like on a scale of 1 to 10, how bad is it today?
Well, it depends on how you look at it. According to the book, the perception is how the patient views it, not how the
Which
nurse
is the
views
scale
Mhm.
that the nurse asks you to
Yeah,
tell her about, right?
yeah.
And I know another point they make is that the patient's perception is always right.
Right.
Whatever, and that's what you're going to get at in that. Mm-hmm. Okay.
Okay.
Anyway, I just thought, just to clarify.
Okay.
Just
So
to
put
clarify.
the pain perception.
I would put
as-
that. Mhm.
Okay.
How about patient perception as opposed to?
Or patient perception of pain. Let's get it all in there. That'd be good.
That might be something to add to number 2 also, to analyze the patient's.
Perception of pain. Yeah.
What if I just take it out of the definition since I have it?
I think
since
it's more of an objective on its own.
yeah.
Because that's
in that
huge.
way,
I did
because
not bring a copy of that. I sent it to you, but I didn't. You want this?
Oh, better let her touch it. Sorry. A copy of what, Suzette? I'm sorry.
Of the one I sent you on
Oh.
my revision?
Oh, I have one here.
Because then that way, instead of doing the definition, then just
I'm
doing
not concerned. I don't catch
That
things
would be a
anymore.
good objective. Contrast patient perception of pain to nursing perception of pain or something. Oh, you kind of do that in number 2.
Uh-huh.
Sorry, I'm a
So,
one.
at number 2, could we, analyzing the perception of pain, that's the patient's perception of pain.
Mm-hmm.
Are you looking at, when you say analyze, you're looking at ways that patients perceive pain or ways that they measure pain?
The way that they view their pain.
Okay.
Did I not word it?
I'm just thinking, if I'm in pain, part of my perception is like worsening. Is that the kind of thing? I'm not sure what you're looking for. Is it like the patient is looking at how the pain has changed over time, so they're comparing it with other kinds of pain?
Well, and then
The type of
the
pain.
acuity of the pain, of whether
Right.
or not it's acute or whether or not
Right.
it's chronic.
So it's
And
you're
it's-
really looking at all the different factors a patient could describe
Right.
to a nurse.
Right.
Yeah, you ask, is it, between 10 and 0, and is it an ache, is it sharp, is it dull, is it,
Right.
is it
Radiate.
constant, is it,
So if you asked a student a question like analyze the factors that go into a patient's perception of pain, that might get closer to the answer you want. Because,
Say that again?
analyze the factors in a patient's perception of pain. You would think they would think of acuity or type of pain, like a throbbing pain or a sharp pain.
Sure.
Or like it's worse than it was this morning.
I mean, you do that several times a day, every day,
Right.
when somebody says, I have a hurting.
But if I read that question, I would think something totally different, and I would put things like culture, whether you're raised to be stoic or
yes.
not.
Uh-huh.
That's what I would think of if I were
Those would be
answering.
like socioeconomic factors
How
and
you-
perception of
been
pain.
brought up to express.
And then that was one of the other ones
Physical.
down
Down
at the
the coach-
bottom.
right.
Was
Express.
that, that I asked, how can you
Factors.
look at a patient and tell whether or not the patient is hurting based on a nursing assessment, other than because of the culture.
You
Yeah.
could say analyze the physical and socioeconomic factors in a patient's perception of pain. That would be a great question, because then you could tell if they understood the whole everything that was affecting the student. You think of like a male who's not going to,
Oh, males do.
yeah.
One thing too that Dr. Hackler and I talked about today when we read these again is, remember, you've got to think like a first-year nursing student. And that's really hard to go from
It's
your level of,
impossible.
Right.
lots of expertise and think about, especially when you're writing test item questions, how they're going to understand that. And so what you said, Charlotte, was valuable because you said, I wouldn't have taken it that way
Right.
at all. I would have taken it another way. So next week when you bring your first draft of your chapter test, you all will have to put on the cap of a first-year nursing student and read those questions from that perspective when we do peer review.
Okay.
And essentially
Is this a
do what
first-year
Charlotte did
nursing
and
student
say, well, I'm reading
who's
it a different
worked
way.
as a CNA, who's an LPN, or is this a first-year nursing student who's never been in the hospital? You never know.
Yeah, that's true. That is true. It would be anyone who's taking a fundamentals or foundations course, because that's what we're working from. So let's assume that they haven't been through that experience. They might have been a CNA, but let's start real baseline. And
But, more and more, the journey is from a CNA to an LPN to an AD degree to a bachelor's, and this is the bachelor's
right,
course, is it
yes,
not? It's not the AD.
right.
Yeah, so
So they may have had some.
you might get an RN, who, I mean, a person who's already passed the RN.
That's true.
I guess you could have, a whole level of students in the class. I don't know. I've never taught a nursing class.
Right. Well, I know when our nursing faculty writes tests, they're writing it from the perspective of students not having had background in the traditional program. But
Sure.
that is different in the
Absolutely.
other programs. So
Yeah.
again, it all goes back to student demographics that we've
I
talked
had
about.
2 classes in the
Right.
RN to BSN
Right.
class, and with the same group, and they were all active working nurses.
Nurses,
RNs. I mean, obviously RN to BSN.
Yeah,
I thought that would make a huge difference, and of course, I have an extremely limited, this is just anecdotal, but like the group I have now, all of them are either CNA or work in a medical office except for one, and she's a banker.
She's a baker.
Banker.
Banker.
She has a banking.
Banker.
Wow.
And I tell you what, when it comes to being organized and making a care plan and getting everything in the right spot, who do you think's the best?
The banker. The banker
Yeah,
is
she'd
the
have to be.
best.
No, the only place where she lags behind the others is she's a little bit nervous walking into the patient room.
clinical setting, yeah.
But other than that, I'll take the banker anytime.
And if she has a CPA, you're really in good shape. So basically, these are, I like the way you have been real specific on those.
Yeah,
From
the
your
rest of them are
first
very
from your
specific.
first version to your revised version.
I would probably put 2 and 9 together and address Charlotte's
Yeah,
point
and then
about, is it the physical perception or the physical factors or the, so like you're tired, you haven't eaten well.
and then
or
your
the
second one could be
socioeconomic.
explain the misconception of pain and pain management. That's a standalone on its own.
Okay.
Are there other terms that we could use besides explain that you have used? Like describe?
She's used
Or-
describe.
You can use discuss, but that's not very specific, and I tend to veer away from discuss.
Sometimes, if you want them to know steps, I'll say outline. If it's something with steps involved, like some of yours might fit
Like
that,
number
Suzette.
5, you could make that an outline or list, just the word list.
Yeah, list the nursing assessment process. Yeah. So.
That would be easier to grade if you told them to list, because then you would be looking for a series of items in the appropriate order.
I would never put it on a formal objective, but I'm just wondering, is there a place for words like, because I know I use them when I teach, imagine, or let's pretend, using analogies?
Well, you would use that when you were evaluating, but I don't think you would use that in an objective.
Okay.
You could get at the objective by putting them in a say, imagine you were in this situation,
So that
but
be
it would be
method.
measuring the objective. Yeah.
It could be a setup to a test question.
Right. Mm-hmm.
certainly.
Or a discussion, class discussion. Right. Yeah.
Because you're asking them to envision, correct?
Yeah.
Mm-hmm.
What would happen?
Okay.
So on this, with the objectives, you know, according to the sample, she puts how she does the methods and the evaluations. Do I need to do that on here, how I evaluate the methods and the evaluation? Because on hers, she has vocabulary test and...
On whose are you referring
The
to?
sample
Yes, ma'am.
lesson plan that we looked
Oh.
at last week from Brooke.
The one page at the front.
Mm-hmm.
Right. That will. You'll have those 3 columns.
Right.
Mm-hmm. And you're asking if you will evaluate all of them.
Well, do I need to add the methods and the evaluations to this list of objectives?
Yes, you'll make 3
according to-
columns. Mhm.
Okay.
And you're required to do at least 7.
I'm not sure I would
So-
tackle 11.
Right.
It'll be easier, it'll be a more manageable project to keep
It's
it.
and it's really going to be what kinds of teaching learning strategies you develop, you know, in your test items. So yeah. Okay, good job, Nikki. I can see you're getting it. That's good.
Okay, Suzette, after studying this chapter, students should be able to define the following terms. I have a question on the standards. Do you really want them to list several? Like identify some rather than define?
There's 3 on intellectual and 3 professional
Okay.
standards.
I don't think
in the book.
Right, I
And,
don't
and
think these are
originally I had and then
Together.
I thought, well, wait a minute, maybe those just need to be defined.
Yeah.
You could do an enumerate
Mm-hmm.
or identify, like 3, and I would tell them how many, because they'll ask you, how many am I
Yeah.
supposed to?
Well, if they've
right.
read the chapter,
Mm-hmm.
now, and again, you know, where are we in this
Mm-hmm.
with our students?
Mm-hmm.
Is this the first day of our class?
I think I would say use something like identify in those last 2, because you really don't want them to define. I mean, competency is a term you can define, but you're really wanting them to break it down, right? You want
And
them
list.
to talk about different intellectual standards, or list the intellectual standards,
Probably.
rather than saying an intellectual standard for critical thinking is, it gives some theoretical definition.
So kind
Well,
of.
but the book does, as a matter of fact, give a definition.
Right, so which one do you want a student to do?
I hadn't thought about that.
Because I think, it's one thing for somebody with a PhD who writes a textbook to give a definition of intellectual standards for critical thinking, but a student's more likely to say, one intellectual standard is blah, 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 second intellectual standard.
Hang
It's
on
more
just a
concrete.
sec.
Hard to put your
Yes.
got the
mind
notes.
frame
You
back
chose a
to...
tough chapter, Suzette.
You can't
I
unknow
what?
what you know.
I said
and
you
it's
chose a
really
tough
hard.
chapter.
And as,
I chose a tough chapter. Oh golly, I love critical thinking, and I don't think it's tough personally. But
It is hard to think back to.
yeah, I had
Starting
problems
out.
when I was trying to word it, and my wording is, for lack of a better word, sucks.
Well, we can help you with wording. Don't worry about that.
I would probably go with list for these 2.
an intellectual standard is a guideline or a principle for rational thought. That's the definition of the book.
Is that what you want the student to tell you, or do you want them to tell you what some of them are?
Again, I'm sorry, I didn't think.
That's all right.
They need to know what they are, but then, how to define it, but then they need to know what they are as well.
Yeah.
There are 14 intellectual
Yeah,
standards.
and they're
that
not going to
they've
possibly know
identified.
all 14 of those.
No.
So maybe
no.
identify here,
And then the professional standards is the same way, there's 3 of those.
3. And then you would take any of the 14, if you phrase it that way.
Okay.
Mm-hmm.
I think the rest can certainly be defined.
Mm-hmm. But you definitely want them to list the 5 steps in the scientific method and the 5 steps in the nursing process. Those they need to know backwards
And
and,
you might even
forwards.
say in order. For a beginning
Yes,
student.
in order. So I would make those back to statements, objective statements. But I like the way that you make
So,
some of the other changes too.
And if you said this in class, I missed it. We're going to write the test questions based on what we have said are our
Objectives.
objectives. Okay.
Right.
No, because I wasn't thinking that way.
Yeah. These objectives will be the foundation for all of your teaching learning strategies and for how you're going to evaluate. You won't evaluate every one of these on your chapter test. You will evaluate them all in some fashion, whether it's a classroom assessment technique or if it's a journal, all the different things that we'll be talking about. So,
Well, and you all know I've been teaching for almost 20 years and I've never made a test because we don't have any tests.
Right. So, but you guys are going to be paying me extra tonight because I brought you test banks for your chapter. So you're going to be paying me extra. No.
Well, now I looked at the stuff for that chapter, and there are some test questions.
Yes.
In that stuff.
Well, there are questions at the end of each chapter, review questions that you can work from, and then I brought you from the instructor's guide.
Okay.
Can I make a suggestion here, just based on hearing a lot of student complaints about why they didn't get all the points? I think I might use the word illustrate here, and ask them to give an example on a test, on an actual test for this. Because they can discuss up here theoretically, and you have no clue whether they can actually understand it in a real-life setting. So a test question, for an objective, you might be able to say, and this is a little closer to Charlotte, what you were talking about, be able to illustrate how assessment information leads to diagnosis.
Yeah.
So on a test, you
You
could...
can use illustrate on the
Illustrate or
objectives. Okay.
give 2 examples.
Or
You could
exemplify,
or-
if you just want one.
If you want one, if you want 2 examples or whatever, yeah.
That would tell you more that they understand it than they could discuss it theoretically.
Discuss is a term that students can interpret so many different ways, and some will discuss it in 2 sentences, and some will discuss it in 10. So if you use another term that would...
I've had very poor luck getting students to give me what
Okay.
I wanted.
Let me ask you a question. Now that
Now that it's clicking,
it's clicking, when I start to write the test questions, can I change the outcomes? Is it too late, or am I stuck
It's
with
not-
these?
it's not too late, but what we're trying to do is help you refine them on the front side so you don't have to tweak them on the back side.
I understand.
But if you need to, slightly, sure.
Okay.
Yeah, you'll think of something better.
Yeah,
on something
and
easy.
right,
Okay.
yeah.
Okay.
Yeah, but the goal is to have it as near perfection by week 6, as we
I
can.
understand.
Yeah,
Yeah, no,
And that's
believe
why-
me, I do understand. But for some reason, that just didn't click.
didn't click last week.
No.
Well, that's all right. That's all right.
May I ask a question?
Oh,
It's
yeah.
not my turn. When you're doing these objectives, but there's a main point that they should be able to pull, and you're just, for example, the pain management, there's technically not a definition within that chapter of what pain management is, but that's the main concept of being able to understand pain. Can you pull definitions that you think that are relative from the chapter that they should know, that they should be able to define? But if it's not written out in black and white, and if you're dealing with the first semester, most first semesters or even first year nursings, they want the black and white. So can you do that?
Well, certainly, because you might even talk about that concept in class.
That's what critical thinking is, right?
Mhm.
Yeah, but
Right,
if
that's
you're
what I
dealing
was
with
going to say.
semester or first year nursing students,
Well,
they have no critical
I would
thinking
think-
But they
skills.
should be able to synthesize.
Right, by the
See,
time you
that's what-
tested them, you would have discussed it in
Mhm,
class.
Okay.
mhm.
And so they
Yeah.
would have a
Yeah.
better,
Okay.
Yeah.
a more fully developed concept.
And
of
this leads
clinical
to,
pain management.
when you're thinking about your mini lecture that you're going to develop for this chapter and present, that might be a concept you will definitely want to incorporate.
And you were talking about test questions, right?
Well, the objectives from throughout the whole process, because in the book, with pain management or with pain, you've got to know how the patient thinks, what your beliefs are with pain, and blah, 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 to be able to effectively manage a patient's pain. And it kind of writes it out, but then it never says pain management is. And if you're dealing with first semester students, what's the first thing that they're going to do? They're going to go directly and try to pull those definitions out of the glossary. Well, there's no glossaries nowadays, but out of the chapters.
Yeah. But also, if it's like a multiple choice test, you can also, maybe the question and the answer isn't specific, but there are other three choices.
Well, I didn't know whether or not we could pull that information
Oh,
and
sure.
put it in if it's not one of the written out bold things within the chapter.
I'm just reminded of Jennifer's test question about some weird kind of cancer, and she was
Right.
saying, well, will they know? And I said, it doesn't matter. It's the fact that they can't do chemo.
Right.
And that's what I think of when you ask that. Is, are there other things in the test question that'll help lead them to the answer, even if it's something initially unknown?
And we'll help you as you get further into that. But that's good.
Well, let me ask you a question. When you teach from a textbook, do you rewrite the objectives for every chapter? Or
Oh, right,
use the one that the
Oh, no,
the
no.
author
I
wrote?
create my own because
Yes.
most of my textbooks don't have objectives created for them.
My objectives determine my choice
Yeah.
of textbook.
And also,
Does that
it
make sense?
determines the order of chapters and which chapters I use. I don't think I've ever gone chapter 1, 2, 3.
I
I've
don't
never
do
gone
that either.
sequentially.
No, I don't do that either.
No.
It fits to a course
So, yeah.
plan.
Nursing is a profession that's sort of fortunate in the fact that it's so objective driven because of your accreditation bodies, and so textbooks and materials almost always will have objectives in some form. They may not be the ones that fit your teaching. Like I said, Potter and Perry, it has objectives, but not necessarily what you're looking for. So yes, we create our own.
Could you comment a little bit on this last one? What's the main thing you're wanting them to know there?
There's a list of attitudes for critical thinking, and I want them to identify and discuss the application of the attitudes of critical thinking that they use in their nursing practice. Again, I'm assuming this is a BS, an
Right.
RN to BSN class that I'm teaching.
Identify
Okay.
and give applications, or identify and apply.
Maybe just shortening that. I like that. Identify and apply attitudes.
I think this is a little.
You could give them a short little case study, and then they could respond to that.
I forgot how many attitudes there are. There's a bunch.
Well, we know there are at least two,
And I
good
might
and
just
bad.
say in nursing practice, because I'm trying to take out words that might confuse them, like discuss the application in your. So discuss and
11.
apply
I
attitudes
mean,
for
and there are
critical
things like
thinking in nursing
confidence,
practice.
thinking independently, fairness, responsibility and accountability,
Yeah.
risk-taking, discipline, perseverance, creativity, curiosity, integrity, and humility.
Right.
And
Are the
again, you-
attitudes of, according to the author, attitudes for critical thinking.
And kind of like back on the identify at least 3 of the intellectual standards, you may even want to quantify when you get working on your final plan. Identify and apply 3 attitudes
Oh, they should be able to do
for critical
4.
thinking, or at least
A list of
4.
11?
Well, she's a harder teacher than I am.
No.
At least 4
4?
attitudes for. But
That's a
again,
third.
quantifying it is just very helpful. Just helpful to your
Because
students.
you will have a student in class when you do a test on
Yeah,
this.
and they'll
if
say-
you give them a discussion question, they'll say, how many do we need?
Yeah. Okay. So do you have plenty of notes on that now, Suzanne? Are you good? Okay.
Okay.
Wait a minute.
Make sure you-
Illustrate and what? Exemplify?
Exemplify.
As opposed to explain or
I
contrast.
think this got moved. Hang on.
Oh wait. Oh yeah.
Discuss.
It was. We were putting illustrate and exemplify instead of discuss on.
I wrote on the board.
You can
a
do
minute.
illustrate or give an
There we go.
example. It goes on down. Yeah.
There we go. Right
No.
there.
Okay, yeah, I got that.
That's-
Identify at least 3.
Yeah. And then illustrate or exemplify or give an example
And then on
of.
the steps, list in order.
Uh-huh. But, okay, so illustrate and exemplify instead of discuss how assessment information leads
Yes.
to nursing. Okay.
Because discuss is, like we said, a term that
You might not get
is
what you want.
vague for students. It's interpreted a lot of different ways. And then you moved the screen again, and the apply at least 4 goes on her last one.
Correct.
See where down here, right here. Now you got it. So identify or at least 4, apply at least 4 applications.
Yeah, I got that.
Okay, got that one? Okay.
Okay.
There we
And,
go.
and you crossed out your,
Mm-hmm.
why'd you do that?
Because they might be thinking about things, they might think you're meant, okay, do I talk about things I'm already doing
Yes.
and things that I do, or does she want just generally anything that would be something a nurse would
Well,
do?
I mean, we all practice in a different area, so,
But a first-year student has no,
okay, remember I'm
Experience.
teaching the RN to
BSN.
BSN.
Yeah.
okay.
I will not teach traditional students.
I think
Yeah.
if we do that, you'd want to say in your current nursing
Yeah.
practice.
Current nursing practice.
Okay.
Yeah.
That works for me.
So they know
Yeah.
that you're trying to have
For
them
what's
apply
happening
to
right
their own
now. Yeah.
experience.
No, I mean, I teach adults. I
Yes.
have university teaching 18-year-olds.
Anything else on these? before they do
No.
this?
No. Okay. You are getting the hang of it, Suzette. That's good.
Oh,
And we have Charlotte's.
okay. Where are Charlotte's?
You were going.
I don't want the middle.
They're in. Yeah.
They're on the
She sent
middle
hers in the
page?
Word
Okay.
WordPad format. I'm sorry, Charlotte. I couldn't pull them up on my computer at home,
Let me
and I've been at
find
home, but she can pull it up on here. My computer at
What
home
are
isn't
they?
quite as sophisticated.
I used the right kind.
No, don't panic. It was just because I was at home. I've been sick, and we can pull them up on this computer. It's under the very first week under assignments. Right. Upload revised chapter objectives. Yeah, right there. Yeah,
Alright.
yeah. All right, I'm going to touch the eraser for warning you.
Okay, I'm not touching it.
Okay.
I'm serious. Oh, it's a WPS.
Yeah.
That's WordPerfect.
Yeah, and I
That's the problem.
My computer-
It's not a notepad, it's WordPerfect.
yeah, my
I thought I converted it to Word.
so I couldn't
Can
I couldn't
you-
open it at home.
Can you, Charlotte, can you dump it right in the, can you dump it in an email? And send it to G. Hackler real fast? It is warmer out there than in here, so I opened the door.
Okay. All right, I'm
We
gonna
are
tell
getting
Jennifer,
a bit
give
of a
Jennifer a
signal.
message. Jennifer, we're having a little technical difficulties with Charlotte's objectives, so I'm going to turn this off right now.